I think that at CMU we have a lot to offer. We have an extremely well-balanced program. And so I think we create probably the best podiatric physicians and surgeons in the region. We're affiliated with a major medical school and university. The huge advantage of that is that all our learners are with people who want to teach.
I think the best thing about the CMU program is our relationship with our faculty. Anytime we have a question or a problem, our faculty is really accessible and easy for us to get a hold of. This is the furthest north program in Michigan for pediatric medicine and surgery, and so we get great exposure to all different kinds of trauma and patient experiences here. I've completed all of my required surgical and patient contact hours within my first year of residency, and I've almost tripled them at this point at the beginning of my third year. We're hands-on from day one, so we're getting all different kinds of experience here at CMU.
Our rotations are second to none. And the surgical experience that our residents get is fantastic. It's not only is it voluminous, but it's also extremely well balanced. We also offer rear foot and ankle reconstructive surgery. So the full gamut of everything that a podiatrist wants to learn, can learn, and then take away from the program when they go out into practice is all right here at CMU.
It's a great place to be learning for your residency or fellowship. We have so many opportunities within our programs, and then also to work with the other residents and fellows. We all get to know each other and work together, and so there are so many opportunities both within our individual programs and then working together as a collaborative team.
We want them to learn, and the best way to learn is to have somebody who's skilled, who has experience, who can teach them.